When it comes to rosacea, there's one hidden culprit that dermatologists do not talk about. And research shows that 90% of rosacea patients, yes, 90% of rosacea patients have this issue. I've also noticed it in my own practice that pretty much all the rosacea clients that come and see me, I immediately ask them to go get tested before we treat the rosacea issue. And that is SIBO, small intestinal bacterial overgrowth. So if 90% of rosacea patients have SIBO, and rosacea in my part 1 series said that it's not a skin issue, that it's a gut problem, let's attack this through the gut, because research also shows that when rosacea patients have been treated for SIBO, the majority went into clinical remission from the rosacea, and it held up over a 3-year follow-up. That's not just coincidence, guys. That's mechanism. So what's really happening when it comes to SIBO? When bacteria overgrows in the small intestine, it creates a cascade of dysfunction, damages the gut lining, it drives leaky gut, and it spills into your bloodstream. Remember I talked to you guys about how your blood has to be clean, and the 2 dumping grounds that the toxins love to go to is the blood, which affects our skin, as well as our connective tissues, which allows for a lot of autoimmune issues. So if your skin is already primed to overreact, which rosacea skin is, that systemic inflammation shows up in flushing, in papules, in pustules on your face. And here's what's really important to understand. We're not just chasing the symptoms, guys, on the skin. We're really asking why the immune system is in this constant state of alarm. And SIBO answers that real question. It doesn't mean, guys, that everyone who has rosacea has SIBO. It's just one of the key drivers that we need to actually investigate and not just assume or guess. We need to look at the full picture. And if you've been managing rosacea topically and it's still flaring and you're still having issues, please, maybe it's time to look below the skin and look into your gut. This is why I have this one-on-one consultation for $99, where I really do a full analysis and give you an 8 to 12 page summary, as well as, guys, go to my website. There's a root and bloom tea that will really help with inflammation. It just helps aid in your rosacea symptoms as well. It does not treat, guys. So look at the link to my bio and follow me for more of these type of awesome treatment advice. Thank you.